Hello everyone, my name is Dr. Joel Schwartz. I'm a board certified chiropractic neurologist and I practice in Monroe Township, New Jersey. The purpose of this video is to demonstrate some examination techniques for you, my telemedicine patients. What I want to do is show you what we're going to be doing during our examination of your lower back so that you can just briefly watch this video and then be prepared for what I'm going to ask you to do during your examination while you're in your home and I'm here in the office. Okay, so we're going to start out with you standing up. And what I'd like you to do is arrange your laptop so that I can see your entire body from your head down to your feet. I'm going to back up just a few feet here. So make sure you put your laptop far enough away and angulate the screen so that you can see and visualize your entire body when you stand a few feet away. Okay, so you're all set. Now we're going to do a few movements. We're going to be bending forward, backward, side to side. And I'm going to describe exactly what I want you to do. So we're going to start out by just bending forward. Keep your knees straight and just go straight down as far as you can towards your toes. This may hurt when you do it, but that's part of our examination. We need to see how you feel in that position. And then just come up slowly. Okay? So you just bend forward with the knees straight and come back up. That's movement number one. Movement number two is going to involve you bending backwards. And I want you to take your hands and put your thumbs in your upper buttock. I'm going to turn around just for a second just so you can see. But my thumbs are on my upper buttock and I push in a little bit on both sides. So that's how your hands are positioned. So you're going to turn around facing your laptop again. And this time you're going to bend straight backwards as far as you can go. And it may hurt, but it's part of our examination so we can figure out what's wrong. So you bend straight backwards and then come up. And as we do these, I'll be talking to you through the internet and we'll be instructing you a little bit more whether I want you to hold it, how you feel in that specific position, and where the pain is located as well. This is going to give us a lot of information. Okay, so that's movement number two. Movement number three is to take your left hand, put it in your upper left thigh along the side here, and then you're going to move both of your thighs to your right. So we're just going to shift your thighs to your right, and as you do that, you're going to bend your upper body to the left. And that's movement number three. Now we may ask you also to do a little of this, just to bend backward in that position. Okay, so we come back up. Movement number four, take your hand, do the same thing. Upper right thigh on the outside, push your thighs to the left, just like this, just like you're swaying to the left. And your upper body's going to go to the right. And then you may bend backward a little bit if I need to ask you to do that, okay? That's movement number four. Movement number five is going to be like this, hands in the upper buttock again. We're going to go straight backwards, and this time we're going to twist. So we're going to bring the left shoulder backward and the right shoulder forward as we keep leaning backwards. And then, of course, I'll be asking you how you feel and where the pain is. Okay. That's movement number five. Movement number six is the same thing, the opposite direction. Straight back. Bring your right shoulder back, your left shoulder forward. And then back to the center. So those are six movements that you're going to be doing for me actively. And then one other thing we're going to do is I want to look at the contour of your spine. And you may be able to see when I bend forward that I have a right-sided scoliosis in the mid-back and a left-sided scoliosis in the low back. That's what I want to see on you. I want to see if you have a curve in your spine. So we're going to try to get you to bend forward if possible to where your back is kind of horizontal with the plane of the floor. If you're in a lot of pain with that movement or with any of these movements, we're going to restrict it. So don't worry about that. Okay? So I want you to bend forward to about this position so your back's horizontal with the plane of the floor. Just hold it there so I can take a look at your back. And come up, okay? So those are the movements that we're going to be doing in the standing position. So now we're going to go on to the sitting and then the lying positions.